Hey everybody, Dr. Kristen here at Van Every. Um, I am here today to talk to you all about how you can maintain your health while you're at home, since most of you, are not able to come into the office right now. We got a little funny setup going here so that you can actually see a PowerPoint while I do this by myself in the office. So bear with me. I'm going to be tucked over here in the corner while I'm talking to you about how to have help from home so that you guys can actually have some visuals to look at while you're sitting through this. So for those of you that have been to our wellness workshop before, you are going to recognize a lot of this, but a refresher never hurts. Something that I'm really just going to jump right in here, and something that I want to start out with is how to gauge your health. So how do you know that you are healthy? And the reason I ask this question is because a lot of people tell me that they're not sick, they feel well, they're healthy. And the problem with that is what's really happening is that people think that this is what's going on. You're toggling back and forth between sick and healthy. So if you feel sick, you're sick. If you don't feel sick, you're healthy. However, in the reality of it, you're actually toggling back and forth between sick and not sick. And what I mean by that is going by symptoms doesn't always mean that you're healthy. So let me ask all of you this. I want you to just sit there and think about it. How many people do you know that have experienced heart disease? How many people do you know that have experienced cancer? When I ask this at our wellness workshop, almost everybody raises their hand. Everyone knows someone who has been affected by heart disease or cancer. What I want to ask now is how many of those people, before they got diagnosed with heart disease and cancer, were actually healthy? They weren't. So the symptoms were the last thing that showed up. They weren't healthy until they got diagnosed with heart disease. They weren't healthy until they got diagnosed with cancer. They had a lot of this dis-ease process going within the body, and they weren't healthy beforehand. Symptoms just didn't show up earlier than that. So we can't go by symptoms to find out if we are healthy. And that's why it's so important to do these things that I'm going to talk to you about and care about your health even when you think you feel well, because things can be going on that you're not really knowing are going on within your body. So there are a lot of health tips that I could go over with you guys today, but I'm going to pick about 5 that are what I think the most important and easy for you to be able to do from home. So the first one that I'm going to start with is sleep. So we got a cute little sleeping dog over here. Sleep is really important because it's the time for your body to mentally and physically repair, and that's really important for healing and for immunity. So when you are sleeping, like when somebody is sick, you are always told that you need to make sure that you get enough sleep. And the reason is because when your body is in that sleep mode, it goes into rest or digest, and the body is actually able to do all the things that it needs to do to help repair and heal your body. So I left a little blank in here because I want you all to make a guess in your brain how many hours of sleep you think the average adult needs. So the average time, 6 to 9 hours of sleep. A lot of people are surprised to hear that because there are many people out there who say that they function just fine on 4 hours of sleep or just fine on 5 hours of sleep. And good for you, that's awesome. I'm not one of those people. But even if you are able to get through the day on 5 hours of sleep, your body still needed that 6 to 9 in order to heal and do what it's supposed to do. So, and I did put here that kids do need more because they're still developing and growing. If you are someone that does not currently get that amount of sleep, 6 to 9 hours of sleep, and it's more so because you just know you can function on less, I want you to make an effort to try and increase the amount of hours that you're sleeping. So you can start with doing something as easy as setting an alarm on your phone, reminding you that it's time to get ready to go to sleep, and try to do some things to get yourself through that process. So what are some things people can do that struggle to be able to turn their brain off to go to sleep? Meditation. I've talked about this with a lot of patients. I talk about it with a lot of different topics because it's also great for learning how to decrease stress. But doing an easy meditation before bed is a great way to try and get your brain to calm down so that you can actually go to sleep when you need to. There are plenty of different ways to meditate. You can go online. Google's a beautiful thing, and look at different types of meditation, see what works best for you. And for those of you that have never done it, don't give up after 1 or 2 times. It's like playing a sport. You got to practice to get good at it. The next thing you could do is no technology. And many of you have heard this. Turn your TV off, turn your phone off, your computer off a certain amount of time before you go to sleep. Because even though you might think that you can crash right after, you're crashing because you're exhausted. Your brain, however, is still stimulated by all that light that was going into the brain, going through your eyes, all that. So I also want to make sure to say sleeping with the TV on, no good. When you are sleeping, your brain is still listening to everything going on around it. So if you have the TV on, your brain is not getting the type of rest that it needs, because your brain's still listening to TV, even though you don't realize that you are. And then another one, let's see here. Journaling. Journaling is a great way to get things out of your brain. For those that are constantly thinking of all the things that they have to do the next day, write it all down. You'd be very surprised how much that helps with letting the brain calm down. And something a lot of people don't think about is a food journal. There are people out there who sleep great some nights, don't sleep so great some other nights. They don't really know what it is that caused that. And a food journal is a good way to see how much what you're eating is affecting your sleep. Some people don't do well if they have stuff with too much sugar for dinner. Some people don't sleep well if they have too many carbs at night. And some don't sleep well if they just eat too late at night, because the body's digestive process actually keeps them awake, keeps them from falling to sleep. So these are a few tips that you can do in order to help increase your ability to sleep. There are a lot of other tips that I could be giving you on how to sleep, but these are mainly what I just want you to learn from this, is that you need to be getting sleep, and you need to actually be taking some steps to make sure that you get good sleep. Now, this is still on the topic of sleep, but what is the best position to be sleeping in? So first, let me ask you, what's the worst position to be sleeping in? That would be your stomach. And what's the best? That would be your back. So how I explain sleep position. Imagine the position that you're sleeping in. So for those of you who sleep on your stomach, put your head to one side, because that's what you have to do in order to sleep on your stomach. And now walk around like that all day for about 8 hours. It's going to be very uncomfortable for your body. When you are sleeping in that position, you have your body you have your spine in the incorrect rotation or flexion or extension when you are sleeping on your stomach. For those of you that like to sleep on your side, that is okay. I'm a side sleeper as well. What you want to do, though, is try to get yourself as close to neutral as possible. So what I mean by that is, if you sleep on your side, put a pillow between your knees. Because if you think about it, if these are our hips, this is funky on this camera, if these are your hips, when you're sleeping on your side, you still want your hips like this. If you are not using a pillow, let's say this is your hip that's on top, it's now rotated over to try to meet your other hip. So you can see how you've got a lot of hip rotation throughout the entire night that you're sleeping. So put a pillow between your knees. Also important to make sure that your neck is not too far one way or the other. So that means pillow is too flat or pillow is too thick. You could go ahead and take a selfie of yourself, or have someone take a picture of you while you're laying on your side, and you can actually see how much your neck is bent. So sleep position is very important. I know we don't want you screwing up what we fix here in the office. The next topic I want to talk about is hydration. Drinking water, very, 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 very important. Why it is so important? Well, it's because water makes up 60% of your body. So wouldn't it make sense that you want to make sure you keep replenishing that? Water is essential for getting rid of the toxins that we put into our body every day. And we all know we're overloaded with a lot of toxins. We're putting them on our body, we're in our body. Sometimes we can't escape it when we're out in the environment. So you want to make sure you're getting enough water to be able to detox. And how much water do you want to be getting? Well, I have an equation up here. You want to take your body weight and divide that by 2. And that's how many ounces of water you're supposed to be drinking a day. So if someone's 100 pounds, they want to be drinking 50 ounces of water a day. The first thing that you can do to make sure that you actually do this is buy a water bottle. If you have a water bottle, you greatly increase your chances of drinking water throughout the day, because it's very easy to carry this around with you wherever you go. It's not as easy to carry a cup of water around wherever you go. Another tip, and why there's a picture of rubber bands up here, is if you have trouble keeping track of how much water you drink, we have a rubber band trick. So what this is showing is that I need to drink 3 of these full water bottles every day for me to have the proper amount of water. So at the beginning of the day, these 3 rubber bands were all up top. I've already drank 1 full. I'm almost done with this one. Once I finished 1 full water bottle and had to refill it, I moved 1 rubber band down to the bottom. Once I finish this next one, which is almost gone, I move another one down to the bottom. So now I'm aware that I have to still drink 1 entire full thing of this water bottle. It's a great way to keep track of it. It will definitely improve the amount of times. It'll trust me, it will improve how much water you drink, because if you lose track and you look at it later on in the day, you'll realize, oh my gosh, I still have 2 full water bottles to drink. So great trick in order to drink plenty of water. The next topic I'd like to talk about is exercise. So this is everybody's absolute favorite topic to talk about, because everyone loves exercising so much and it's so easy, which is absolutely sarcastic. I don't think it's a secret that exercise is really integral for living a long, healthy life. And when I say exercise, I don't want you all to get scared and cower away. Exercise doesn't have to be high intensity workouts. It doesn't have to be the CrossFitters. It doesn't have to be Orange Theory. Your form of exercise could be better for your body, or shouldn't say better for your body. It could be better for just you individually. So some people, exercise means hiking. It means playing with your kids. You need to be active. The best way to get yourself to exercise is to find something that you actually enjoy doing. And I know right now it's a little difficult, because a lot of us are not able to go out and do the type of exercise that we want to do. If you're like me, you don't get to play sports. That's my primary way of exercising. There are people who really love doing the group classes, and they're not able to do that either. So this is our time to really work on self-discipline and let ourselves know that we have that ability to make ourselves do something that we don't really want to do. But still, it's very important to keep exercising through this time. It's very important for your health to keep exercising and keep moving. They say sitting is the new smoking, and that is absolutely true. If you are going to sit around and be sedentary throughout this entire situation, you're going to decrease your health and your ability to respond to any type of illness that comes your way. So what's your ultimate goal? Ultimate goal is to work out 30 minutes a day, 4 to 6 days a week. So for those of you that can't do a 30-minute exercise, that could be you have some type of injury, or your body just doesn't allow a really active 30-minute exercise. You can replace a 30-minute exercise with a brisk 3-mile walk. There have been some studies that show that that has the same effect. So you guys can do it. I'm working hard to make myself work out in a different way than what I'm used to and what I actually enjoy. So if I can do it, you can do it. Next topic, nutrition. Everyone's other favorite topic to talk about. I think I would like to hope that most of you have a general grasp on what is good to eat and what is bad to eat. I have 2 images here showing what's good, what's bad. Not the good side. This is the nice, healthy, good side. And the main thing that I want to ask of you when it comes to eating healthier is, when you buy food, I want you to ask yourself, how many processes did this go through after coming from the earth? So that's a great question to ask yourself, because if you keep asking it over and over and over again, at some point, you're not going to grab that thing off the shelf that you realize is completely processed food and has absolutely nothing good for it, good for you in it. So like back in early March, when everyone was rushing to the grocery store and I saw pictures of all the aisles with the potato chips and snacks empty, maybe not the best thing to be grabbing when you're trying to be healthier. What I want you to be grabbing is this stuff over here. So vegetables, fruits, healthy fats, those are things you really want to be focusing on. Processed food, sugar, all that good stuff, not going to make you healthier. And especially if in this time you're really concerned about your health and you want to strengthen your ability to respond to illness, you got to eat healthy. So remember, how many processes did this go through after leaving the earth? For those of you that have kids that are a little bit picky about their eating and you can only force them to eat so much, that's where supplementation comes into play. Of course, it's better to get your vitamins and minerals naturally from food, but I'm a realist. I know it's not always going to happen. I was a picky eater when I was young too. So if you can get kids to take supplements, that's a great thing to do. There are also people out there that need supplements because of other things that deplete their vitamins and minerals. So that could be medications. There are a lot of painkillers and other types of medications that deplete certain nutrients within the body. It could be even just the toxins that we're putting on our body. In our body, they can also cause the body to use up their stores of different vitamins and minerals. So I am a big fan of supplements these days. Maybe 50, 60 years ago, I would have said it wasn't necessarily needed, but today I do think it's needed. But when it comes to supplements, that's something that I'm not really going to go over all of them with you right now. If you're curious about it, it's definitely a one-on-one thing where we can tell you what would be most important for you. Let's see. Last thing. Oh, just another reminder. How many processes did this go through after leaving the earth? I really would love for you guys to ask that question because it will definitely make a difference the more and more you say it. Posture. So posture is going to be the last thing that I talk about. And the reason why is because many of you, all of you probably, your daily environment has changed pretty drastically. And what I mean by that is students are now doing all of their schooling from home. They're on live videos with professors or with teachers. A lot of you are now working from home. You're used to working in an office and now you're working from home. So there's never ever been a better time for me to talk to you about posture and exercises to help alleviate new stresses that are on the body. And here I've got some pictures here of some of the wonderful postural things that are probably going on right now. I've seen pictures of kids laying on the couch with their head up against the back of it, like leaning back like this. They've got their computer up to look at their teacher or their professor. We've got kids playing games all day long, people working on their bed. Terrible. It's terrible. So first thing I'm going to start with is neck posture. One big reason I like to start with the neck is because it's very easy to change the shape of your neck over time. So you can see in this picture here, we've got the nice curve that we like to have. We can see in this one, we've got actually a little bit of a reverse curve. So when you do this, well, before I say that, there are many things that can change that. You could have an actual injury. It could actually be forward head posture, which is a lot of what is going on right now with people having to work from home. But one thing I want to talk about is why it is so important and why it matters so much to me that your neck is curved the way that it's supposed to, is because you can see all these nerves coming out the side. The spinal cord is running through the back here. If I take this curve and turn it the other way, I am pulling on the spinal cord and I am pinching all of these nerves. So when I pull on that spinal cord and when I pinch those nerves, the brain is having issues communicating with the rest of the body, starting at the beginning. So you're going to have issues everywhere within your nervous system. That is why it's so important to focus on your neck, because if you decrease communication within your nervous system, you have a significant decrease in your health. So please pay attention to your posture while you're at home. Do not sit on your bed and do computer work. Do not slouch on the couch. I want you to do your best to sit somewhere where you can have your computer up towards your head. If you're doing stuff on your phone, bring your phone up to your face, because if you're going to be down like this all day, that's what slowly reverses. That's one of the things that can slowly reverse that curve. Let's see here. So what are some stretches that we can do to help with this? I want you to do these stretches, especially if you're someone who does not have the ability to have a proper working environment, like the parents who are having to lock themselves in their room so their kids aren't distracting them from their work. There are some things you can be doing to at least help alleviate some of the stress that's being put on your neck. And some of those stretches are, and you can also check the different videos that we've been posting on Facebook that go over some of these even more. But one of the first ones that I want you to do is flexion and extension. So what that means is you bring your chin down towards your chest, hold that for 5 seconds, and then look up to the ceiling and hold that for 5 seconds as well. It's also lateral flexion. So that means bringing your ear to one shoulder, holding for 5 seconds, and then to the other shoulder and holding for 5 seconds. You can also deepen those stretches by pulling your head just lightly. Do not crank at it. And then the last one to do would be rotation. So it's looking over one shoulder for 5 seconds, looking over the other shoulder for 5 seconds. I highly recommend going through that whole routine about 5 times as soon as you wake up in the morning, and then do it throughout the day if you are someone who is having to be in uncomfortable postures, trying to do your schoolwork from home or trying to do your actual work from home. Something else that you need to make sure to work on is your shoulders, because if you all were to roll your shoulders forward and then pull your neck back to where it's supposed to be, it's not possible. So that means we need to work on getting our shoulders back. So, simple shoulder rolls to help stretch things out every so often. It's also important to stretch out your pectoral muscles, and I'm kind of hidden right now. Let me stand up. So your pectoral muscles right here. What you can do to stretch those out would be to find a corner, and I'm going to do a video of this later to put on Facebook so you can all get a better idea how to do this, because I'm going to explain it, but it might be a little confusing. You can also YouTube different stretches to do. YouTube's a great thing to do. There's a lot of physical therapists and chiropractors up there who put up videos like this. But if you find a corner of a room and you put, let me in the middle here, you put hands on both sides of the wall when you're in the corner, and then you lean yourself into the wall, you're stretching your pec muscles safely without hurting your shoulders. It's also important to strengthen your rhomboids. So those are the muscles that help pull your shoulders back. To strengthen your rhomboids, what I like to recommend is doing wall angels. I will demonstrate that in a video later. You can also check YouTube for that as well. So that's probably the most important things in terms of neck and shoulder. Oh, one thing actually, for people who want a little bit additional work, you can do some light traction. So we do have plenty of patients out there who have this at home. If you have the dental roll, make sure you're using it. The dental roll is just something that we use to lay on to create traction within the neck. If you do not have one of these, what you could be doing right now is rolling up a towel nice and tight and laying on a flat floor and putting that towel underneath your neck so that your head is a little bit in extension, and then just lay there for 5 to 10 minutes. And that will help stretch out those muscles and try and talk to your neck to want to be in the right position. When it comes to your low back, you can be doing that similar type of traction for your low back, rolling up a towel and putting it under your low back. Make sure you're not putting it under your upper back. We can put it under your low back where you have that curve that's the same as your neck, and lay on the floor with that for a few minutes also. I also recommend doing cat-cow stretches. Again, YouTube that. Cat-cow, anyone who does yoga knows what that is. It's where you're kind of just moving the spine in and out. It's a good stretch to do to get things moving. And there are plenty of people right now who are going on lots of walks and saying that they're experiencing pain as they're walking. If that is you, what that means is that you need to be strengthening your core muscles, because most likely you're not activating them enough to actually protect your low back while you're going on the walk. What I like to recommend for people for strengthening your core muscles are plank exercises, and you can vary these completely based on what you're able to do. So plank exercises, the easiest form would be to be on your hands and your knees, and you just start doing small things like raising one arm and the other. Again, I will show all of these to you on a video, and you can also YouTube them. And some people can take their plank to be more difficult and be on your forearms and your feet. I'll definitely post some videos so that you guys can get an idea of how to help with this. Let's see. So I want you to all focus on some health goals right now. There's never been a time where health has been so forefront in everybody's mind, or the lack of health. And I want, just because you guys aren't able to come in here and get adjusted, I want you to think about your health. We aren't able to keep nagging you while you're in here getting adjusted right now. So it's very important to focus on your health. I think this time has reminded all of us just how important it is, because things can come up any day that can threaten our level of health. And remember what I said at the beginning, that just because you don't feel sick does not mean that your body is not in a somewhat sick state. It just means that you haven't toggled into that sickness yet. And we want you guys to be in that healthy zone so that you're not going from what you think is healthy to sick. We want you to go from healthy, and then if your body starts to struggle, you go into not sick mode. We don't want you going all the way into sick mode. So focus on these things. Focus on trying to get enough sleep at night. Start doing some work for that. And then drink plenty of water throughout the day. Get some exercise. Get moving. Make sure you're eating something that is going to nourish your body. And work on your posture. Posture is one of those things that not everybody thinks is so important for your health, but of course, if you are patient, you understand, hopefully, why posture is so important for your health, because if you don't have proper posture, you are going to affect your spine negatively, therefore negatively affecting your nervous system. And you can all see that image behind me where you see all those nerves coming out of the spine and going to all the different organs in your body. So you can see you don't necessarily want those nerves shut down or not communicating the way that they're supposed to. So everybody, be healthy, be safe, be positive. We are all in this together. If anybody has any concerns, any questions, if you just want to comment and say hi because you miss us, please do that. And we are anxiously waiting for when things get to slowly go back to normal and we get to see all your lovely faces at the office and get your nervous systems in tip-top shape and back where they're supposed to be. So I hope that you all have a fabulous weekend. Happy Easter for those of you out there celebrating it. And we hope to see you all soon. Miss you.